So your doctor told you that you have a Bankart lesion, so I'm just going to tell you a little bit about what that means. So between your scapula and your humerus, you have a labrum. Your labrum helps keep your shoulder into place so it doesn't pop out, and it helps deepen that joint. Because of your chronic dislocations that you have while pitching during baseball, it has caused a small little tear on the front part of your labrum, kind of like right here. So now when you move your arm in different positions, that tear gets irritated and it can cause that pain that you are feeling. So the goal of physical therapy will be to restore the motion in your shoulder and make sure that it is pain-free. And then we also want to increase the strength of all the muscles that surround the shoulder to help protect that labrum. And then eventually we'll get back to some baseball activities to help really strengthen and keep the endurance of all those muscles up to prevent another dislocation or further tearing of that labrum. Rehab to get back to your full potential can take a while because we really do have to make sure you are pain-free before moving from step to step. And because we don't want any further damage or future dislocations of that shoulder. Since you don't have your sling anymore, we are going to start off with some low-level strengthening exercises called isometrics. Remember that we still want to avoid that position of dislocation during these exercises and when you're at home. So I don't want your arm kind of going up here because that will help pop this part out. So right now we just really want to maintain your range of motion and the strength that you have. So we'll be doing that with the isometrics. And then when you're in PT, I will be doing some passive range of motion with you to help keep that range of motion until you're pain-free and you can do it yourself. So then once you are pain-free, we'll progress to the next step, which is you'll do some active assistive range of motion. So using like a bar, you'll use your normal hand arm to help kind of raise it up and sideways. So these muscles are doing some of the work, but not all of the work. So it's kind of a step in between to make sure that you're really pain-free. And then after that, we'll go to active range of motion. So it's just you moving your arm to get that full range of motion back. And then we'll start to increase the strengthening exercises also. So we're gonna go from the isometrics against the wall, and we're gonna progress this to closed chain kinetic exercises. So having your hands on the wall and like on the table, those kind of things. And then we'll progress even further to open chain kinematics, which is similar to functional activities and daily life and eventually baseball. So that's our goal. So we're going to focus a lot on strengthening the rotator cuff muscles and the muscles that attach to the scapula and all the surrounding muscles right here to help really stabilize the shoulder for you. And then eventually, a couple months down the road, once you get to that point and you're pain-free, we're gonna start working on some activities to get you back to baseball safely. So that is the plan for physical therapy.